gentle exercise is exercise number 6. So this is, say, somebody who's wheezing, somebody coughing, somebody with panic attacks, somebody with stress. All we do is we have them small breath in, small breath out, hold your breath for 3 to 5 seconds, and then resume breathing normally for about 10 seconds. Then hold the breath for 3 to 5 seconds, resume normal breathing for 10 seconds. Hold the breath for 3 to 5 seconds, resume normal breathing for 10 seconds. If they're having severe symptoms, they need to take medication or contact a doctor, because this exercise will work more effectively if it's used in the early stages of symptoms. And also if, for example, the control pause, if the individual has a relatively good control pause, for example, if we say it's 25 seconds, when they have symptoms, the symptoms are going to be quite light. So it's easier to stop the symptoms, whether it's wheezing or whether it's coughing. It's easier to stop it using the small breath hold exercise, exercise number 6. But if you have a person come into you, your client has a control pause of 5 seconds, when they get symptoms, it's quite difficult to stop them. And, in that instance, ask them to try the breath holds, but if the breath holds don't stop their symptoms in a short period of time, a couple of minutes, 10 minutes at most, they need to take medication. And of course, if they're having a severe attack, they need to take medication immediately. This isn't a substitute for medication. All it is to give people the tools to help calm down their breathing. So, it gives them some confidence that they can stop their own symptoms. And of course, it teaches them the relationship between breathing volume and symptoms such as asthma, hyperventilation, panic attack. So, Catherine, I'd like to go through this next exercise with you. And basically, we use this for people, say, with panic attack or with stress, or even if they've got a racing mind. They could be lying in bed at night and they want to just bring a feeling of calmness to themselves, or people with asthma, people with hyperventilation. So it's an exercise to calm down the breath. And the reason that we do this exercise, as opposed to any of the others, are that if our breathing is a little bit laboured and if we're stressed, it can be quite difficult to calm down the breath because the drive to breathe is too much. So you can imagine somebody who's feeling wheezy, or if they're in a coughing attack, the cough is disrupting their breathing. During the wheeze they feel they're not getting enough air. That's causing them to breathe more. And if they started to do the reduced breathing to calm down, it's quite difficult to do it. So with this one, we physically hold the breath. It's very simple. Again, we have a feeling of relaxation throughout the body. And whenever you're ready, take a small breath in through your nose, small breath out through your nose, pinch your nose, and hold your breath for 3 seconds. 1, 2, 3. Let go. And breathe normally for 10 seconds. So now you just bring a feeling of relaxation to the body. And again, small breath in, small breath out, hold your nose. 1, 2, 3. And to let go. And to breathe normally for 10 seconds. Now we can use the breath hold for between 3 and 5. And again, take a small breath in, small breath out, pinch your nose, and hold your breath for 4 seconds. 1, 2, 3, 4. Let go, and to breathe normally. And again, small breath in, small breath out. Hold your nose. 1, 2, 3, 4. Let go, and to breathe normally. In other words, when you're breathing normally, don't interfere with your breathing. Just bring a feeling of relaxation to the body. And again, small breath in, small breath out. Pinch your nose. 1, 2, 3, 4. Let go, and just breathe normally. Just bring a feeling of relaxation throughout the body. And again, small breath in, small breath out. Pinch your nose. 1, 2, 3, 4. And to let go, and to breathe normally. And usually we hold the breath for about, it's no more than half the CP at that time. So somebody who's under a lot of stress, or if they're in an asthma attack, their control pause might be just about 6 seconds. So in that instance, we'd only have them hold their breath for 3. Because we would like you to hold your breath, but not to the point that it causes a disruption of breathing, because that will only feed back into the symptoms. Okay. So again, take a small breath in through your nose, small breath out, pinch your nose. 1, 2, 3, 4, and to let go. And again, just to breathe normally and bring a feeling of relaxation to the body. The success of this exercise depends on two things. The sooner we start doing the exercise, the better. So upon the first signs of symptoms, the first signs of stress, panic attack, hyperventilation attack, or asthma symptoms, start doing the breath hold straight away because it will help keep our breathing calm. The second factor that determines success is the length of our usual CP. So if our control pause is 20 seconds, when we do get symptoms, they're going to be a lot less than, for example, if the control pause was 10 seconds. So if somebody's prone to asthma, and if they have a control pause of 10 seconds, when they get symptoms, the symptoms are going to be quite severe in comparison to somebody with a control pause of 20 seconds. When they get symptoms, their symptoms are going to be lighter. So again, it's the sooner we start doing the exercise, the better. So whenever you're ready again, small breath in, small breath out, pinch your nose, 1, 2, 3, 4, and to let go. So we'll continue it for about 30 seconds or so. And during symptoms, we literally continue this exercise until the symptoms have passed. Now, if it's an asthma attack, if you don't stop your attack in a few minutes, or if you're having severe symptoms, take your medication, take your rescue inhaler, and if your rescue inhaler isn't working, call your doctor immediately. So we use this as an interim measurement, as an interim measure that we can help stop about 60 to 70% of symptoms by using this. But in the 30% that we don't, of course, medication is necessary. So again, small breath in, small breath out, pinch your nose, 1, 2, 3, 4, let go. Breathe normally for 10 seconds. Just breathing gently, breathing normally, not changing our breathing. And again, small breath in, small breath out, pinch your nose, 1, 2, 3, 4, and to let go and to breathe normally for 10 seconds. And again, small breath in, small breath out, pinch your nose, 1, 2, 3, 4, and release and just breathe normally. So if the mind was racing, you're in bed at night, the mind is racing, the best thing to do is hold your breath, and it helps to calm down the mind. And again, small breath in, small breath out, pinch your nose, 1, 2, 3, 4. Excellent. Okay, so we'll take a rest at that. So that's exercise number 6. Another aspect with over-breathing is often hyperinflation. So this is where a person has got a low control pause and are continuously taking air into their lungs, but they're breathing in and not sufficiently breathing out. So what's happening is that the small air sacs then are expanding. To help with that, ask the person take a breath in, and at the top of the breath, bring a total feeling of relaxation to the body to allow the breath out to be effortless. And then a breath in, and then a total feeling of relaxation to allow the breath out to be effortless. It's vitally important with hyperinflation that we bring relaxation into the body. And we can also use the small breath holds, because many small breath holds are quite effective with a person who is prone to overinflation or hyperinflation, because usually these people, they will be more severe in the spectrum of asthma or COPD, etc.